Hi, everyone. Thank you so much. Our hearts are with you in the midst of all that's going on today. I'm sure it's been a whirlwind for you. It's been a whirlwind for us as well. But we're in this together, and in that show of solidarity, we are today really excited to be hosting a webinar on the COVID-19 panel as a response to some of your questions. And also, if I should just say, from the perspective of not being only an entrepreneur and a direct care or former direct care worker myself, just take a moment. I know it's hard, just to breathe. Everyone, just if you're out there, take a deep breath. We're going to get through this together. I'm saying that to you. I'm saying that to our panelists. I'm saying that to myself in this moment. So we're definitely in uncertain times, and we want to be a resource to you all. As we know that you certainly have a lot of questions. I'll make mention of some of the resources that we have available. So we'll give people just maybe about a minute or two as they're coming in before we get started. We have a lot to get through today. Thank you so much for taking some of the time out of your response and your busy days to join us. So we'll get started in just a minute. We'll give folks some time to get on, and for our panel to get situated, and for you to get situated, and to also take a breath. All right. Hi, everyone. If you're here for the COVID-19 panel and how to prepare your agency, you're in the right place. Just give us 1 minute, and as we're waiting for folks to come in, we will get started at 1:05. Fantastic. Well, hello, everyone. Welcome to the COVID-19 panel on how to prepare your agency. My name is Helen Adioson. I'm the CEO and co-founder of CareAcademy, and I'm joined by some really awesome panelists. If you're just joining us, I want to say thank you first and foremost. I know that we are in some pretty heady times. We're here for you. We are here with you. Our hearts go out to you. And we're here to answer as many questions as we can. This will be one of weekly webinars that CareAcademy will be hosting, just to hear your thoughts and concerns, and also just to be here to support you and your caregivers as we're all dealing with the COVID-19 pandemic. So just as a quick agenda today, as I see that folks are joining us from all over the country, we had well over 1,000 registrants for this webinar today. And in the weeks coming ahead, we saw very clearly this would not be the only opportunity, or it should not be the only opportunity, to make sure that your questions get answered. So we'll quickly go through the agenda. We're going to talk a little bit about CareAcademy, just a quick set of introductions on our esteemed panel today who are here to answer questions about COVID and how you should be responding in turn. Hi, everyone. Everyone said hi. Our panelists' questions and some takeaways from our respondents. We know there's a lot of information. If your inbox is like my inbox, I know you're getting a ton of emails, and so every single time that we talk to you, my teacher brain goes on, right? We want to make sure that you just have a quick set of takeaways that you can utilize for your agency and for your caregivers. Quick takeaways, and then we'll do this again the next week and the week after. As I said earlier, we want to be a resource for you. And then additional resources for you and your caregivers and some next steps for whether you're a CareAcademy customer or not. We want to make sure that we're providing some best practices as well. So very proud of our team's effort in making that available, and we'll talk more about that. So just a little bit about CareAcademy. So CareAcademy, just in the next slide, there we go. We are a #1 provider of online training. We have over 160 hours of training that's available, including classes on COVID-19. We've designed for mobile and have online classes specifically for caregivers to access anywhere and anytime, as well as customer supports in this time. We know that it's important for you and your direct care workers to get access and ready access to the best information, and so have customer supports and people supports to do that, portable training records, as well as an API to help you through that. So just a little bit about CareAcademy. We're an online training provider, just in case, just to all contextualize this. And so without further ado, just a quick note about myself. I don't want to go too much into it because I think that our panel should definitely be the highlight of the day. I'm a former direct care worker myself, CEO and co-founder of CareAcademy. My first and foremost hope for this webinar today is that we provide you all with supports, everyone who's out there, and the resources that you and your direct care workers need in this time. And I'm excited because I'm joined by my co-founder and our Chief Medical Officer, Dr. Madhuri Reddy. She's our Chief Medical Officer and is a specialist in internal medicine and geriatric medicine and holds appointments at Harvard Medical School at Hebrew Senior Life. So for years, she's seen firsthand the struggles that families and caregivers are going through while caring for older adults. Dr. Reddy has published several research papers in prestigious medical journals, book chapters, as well as a book for families and caregivers. So very excited to have Dr. Reddy on the call today to answer your questions. And then we have Colin Zick. So thank you, Colin, for joining us. He's a partner with Foley Hoag, where he serves as the co-chair of its data privacy and security and healthcare practice groups, and is a co-chair at the COVID-19 task force, which is, I'm very glad that we can have Colin on the call today. His practice is focused on healthcare and compliance issues and often involves the intersection of those two subjects: investigations, administrative proceedings, and he also frequently counsels technology and consumer-facing clients on issues involving privacy and security. So any of your HIPAA-related questions today, as well as your concerns around COVID and anything around that, Colin is on the call to answer. And then Kevin Smith is a friend of CareAcademy and is president of the Home Care Aide Council and CEO of Best of Care. He believes that a 360-degree approach is critical to serving the agency's aging and disabled clients wherever they choose to call home. Kevin played a critical role in expanding Best of Care's geographic reach. He oversaw Best of Care's 2013 acquisition of Boston-based Independence Home Care and 2014 acquisition of Westwood-based Access Home Care. And so they serve clients and their families on the Cape, and in 2015 opened a Best of Care office in Dennis, Massachusetts, and so is a large provider of home care services here in the state of Massachusetts. I think that there's no better panel that I think we could have assembled today to talk about the intersection of healthcare, of some of the legal ramifications of what's happening right now as it's fast moving, as well as some of the business implications for home care and direct care workers. So I want to just go ahead and dive right into some of the questions that have been coming up. Also, it's worth mentioning, if you all have questions, I'm sure you have some, go ahead and in the box, in the chat box within GoToWebinar, start posting your questions. If we don't get to your questions today, we have a weekly set of webinars that will be just questions. We'll bring on an esteemed guest and have them answer your questions as best as we can. As of course you all can appreciate, there's a lot of fast-moving information, and we're all trying to wrap our heads around this, so we're here to help do that. So I'll start with you, Dr. Reddy. What is COVID-19 and what do we know so far? I'll also ask, there's a lot of information out there. What are some of the common myths that we should just dispel on this call?
So COVID-19 is the infectious disease that caused by the recently discovered coronavirus, and the name of the virus is SARS-CoV-2. So you may hear both of those words. COVID-19 is the name of the disease. SARS-CoV-2 is the name of the virus. And can you hear me okay? Am I speaking loud enough, everybody? Okay. So these coronaviruses aren't new, first of all. And the one that we were most familiar with for the longest period of time just caused the common cold. One that developed into something much more harmful, you might all remember, was the SARS outbreak back in 2003, and then there was a MERS outbreak later in the 2000s. So this is our third coronavirus outbreak. The other two were able to be controlled very easily because of strict quarantine measures and because they were seasonal and they kind of died out for the most part. This one is different because a couple of factors. One, it doesn't seem to be affected by heat or cold. So in terms of seasons, we're not sure which way it's going to go. And secondly, the initial SARS virus in 2003 was controlled really quickly because it was most contagious when the patient was sick. This particular virus, it seems like it's most contagious when the patient, for lack of a better word, is not sick and doesn't have any symptoms. So it's very easy to spread. And our world now is quite different even from 2003 in terms of the way people move around. So the range of symptoms go from very mild cold and asymptomatic to respiratory distress and death. And I will just add one more thing with the clinical aspect is that we don't know of any children who have died from coronavirus. And most young adults are okay, even though we've been seeing an increasing number of even young adults who have been hospitalized and even need to be ventilated in the United States. But for the most part, the older you get, and there's no specific cutoff, but if you're over 55, your risk is greater than if you're 45, your risk is 7. If you're 65, it's greater than younger. And so the highest risk of death is in those over 85 and in those over 55 with a comorbid medical illness such as diabetes, heart disease, HIV, etc. So while we're, working on getting other things, scientists are working on antiviral, which will probably take 18 months or so. Studies on treatments. Right now, we just manage symptomatically, like you'd manage somebody with a terrible cold or respiratory distress. And what we're most concerned about is that for the people that get really sick, that the whole hospitals will become very inundated because we just don't have enough ventilators. And that's been the problem in Italy, that they now have to triage who they admit to their ICUs. And so that is the major thing that we're trying to avoid here in the U.S. is as the numbers go up, which they will because our testing is going up, we want to make sure that we have enough space in our hospitals. And so there are going to be more and more people discharged out to the community in home care that have recovered in hospitals or are less symptomatic. And this is, I'll just say the other thing about that is that you may hear that term flattening the curve. And what that means is as we're asked to socially distance from each other, we're reducing the rate at which the virus spreads. So the number of people that will need hospital admissions and ventilators we're hoping that that will make the number be a little more manageable rather than everybody being admitted at one time. And you were asking about myths, Helen. I mean, there's so much, I think, scary or bad information out there. The main thing really is to, can't stress enough, washing your hands, regular infection control stuff, don't touch your face. Purell isn't the answer for everything. It's great. It has 60% alcohol. Hand washing is better, especially if there's anything dirt visibly seen on your hands for 20 seconds. Another myth is getting a flu shot will prevent you from getting coronavirus. It will not, but it is important because people who are at risk of the flu are also at risk for dying from coronavirus, so it's better than getting both diseases. So certainly the flu shot will help that, but it won't help with the coronavirus. And yeah, I think the other thing is the other myth is that younger people can't get it, and they certainly can. And the biggest issue with younger people is that they're spreaders. So that's why it's important for even healthy people to protect others by quarantining or staying 6 meters away from everybody else.
Absolutely, and I'm sure that, you know, if you all have heard that in the audience, and we just are reiterating some of those guidelines again, it's best to proceed with those same guidelines that Dr. Reddy just reiterated. Colin, I want to switch to you. So you're part of the task force at Foley Hoag, your law firm, on COVID-19. What are some of the most salient points? I know things are changing minute by minute, but for our audience, can you summarize, you know, some of the things that they should know as folks are part of the home care industry, and, you know, maybe direct care workers themselves? What are some of the points that you all are hearing and are most salient?
Thank you, Helen. I think what we're seeing are the intersection of healthcare and employment law issues that are coming up, and those collide in home care just about as much as they would anywhere else. You have a large number of employees who are serving the population, and we've got rapid change in the applicable healthcare rules. You've got new guidance coming in about infection control and prevention, about telehealth, about HIPAA. All of these are coming in at the same time that we're trying to figure out who is going to be where, who's working, who's not working, who's getting paid while they don't work, and for what reasons. All these things are coming together in home care.
Absolutely. And in the most recent days, can you provide sort of examples of things that home care agencies should be keeping in mind about some of the, to your point, you know, some of the labor concerns, right? What are your sort of best guidelines around the concern of direct care workers who may potentially be infected? What are you hearing around that, and what guidance would you provide our audience today?
Right. Well, certainly we don't want anyone who is infected out there in contact with the population. And so I think that has to be at foremost the message, which is if you're not feeling well, you've got to stay home. You're not doing anybody any favors by going out there if you're not well in this particular circumstance. And get past that. I think most people have that message that they're not to do that, and that we're gonna make sure there's help for the people who are not well. But I think then we've got to start thinking about the modalities in which we're delivering care. Are there ways that we can check in on people without actually going there, particularly if there are folks who are infected? I think those are issues that are now at the forefront. And we're seeing a lot of adaptation in the reimbursement rules and some of the other the licensing rules, the technical rules that may come from the state level together with the federal reimbursement rules. Those are coming together very, very quickly in order to allow for that sort of remote monitoring that needs to happen in all sorts of care situations, and particularly in home care.
So we have a couple questions already from home care agencies who, you know, wanted some of the best feedback around some of the questions that they're getting. So we had an agency owner who, when they found out we were, had this webinar, had a question directly. So we've heard from some of our home care agencies will discharge the client if he or she tests positive for the COVID-19 virus. While we want to keep our staff safe, some of our clients do not have family or anyone else to provide their care. How should we handle this situation? So that was a question that came from the agency owner or administrator. What are your guidance? And Kevin, feel free to jump in also on that question. Would love to hear your feedback, Colin.
Yeah, so I think the first thing is determine, can we care for someone who is tested positive? And if you can, then figure out how, as a secondary matter, how do you reduce the physical contact with that person, but still provide the care? I would hope that we could still be in a situation where we can provide home care to those folks, because the vast majority of them are going to need some help, but they're probably not going to need to be hospitalized. And so they can recover successfully at home if they get the right care. If they can't, then they're going to wind up going into the hospital. And as Madhuri said, that's exactly where we want to keep people out of, because that space is so limited.
Mm-hmm, mm-hmm. And also another question that came earlier from a home care agency, are agencies liable for unwittingly sick direct care workers, or if a client suspects that they may have gotten sick, what is the bounds of liability around that, Colin?
Yeah, I think while it's possible, because it's always possible to have liability, and I'm a lawyer, so don't expect a totally straight answer out of me. But typically, at least we got one laugh out of that. Typically, the state workers' compensation regime is going to deal with the workers and whether or not they are contracting an illness while providing their service in the course of doing their work. So there's a whole regime that already exists that deals very well with this and makes sure that people get all their expenses taken care of if they're not otherwise taken care of. So I don't think that's something that's not new, that's not novel for this situation. There's a program in place to deal with it in most states.
Absolutely. Go ahead, Kevin.
One of the things that I was going to suggest at some point later on during this webinar is something that my team has been doing, was just immediately getting in touch with your insurance broker, talking about what coverages you have in place today. What does that coverage do for you right now, if anything, in the event that you have an employee who has a work-related exposure and subsequent test positive for COVID-19? It is my understanding, I'll defer to you though, Colin, that most workers' comp carriers do not cover viruses. So I don't know if that's true or not, but we're in new ground here that we're all trying to navigate through. So that was one of the first questions that I asked my carrier, was what about COVID-19 exposure? So these are the types of things that once you can sort of get out of the weeds for a minute of the minute by minute operational thing, something to just think about big picture for your company, starts with a phone call or an email to your broker to start talking through these things.
Absolutely. And to what extent do we know, Colin, and Kevin, if you have some feedback on this, would love to hear it. Do we know if there are, for the home care agencies who are on the line, anything as it regards changes to insurance policy or anything that's federally mandated? What are some supports that have been provided by the federal government? We're certainly hearing announcements from CMS, and we're hearing, announcements in terms of the labor side. Right off the bat, are there supports in place for home care agencies as small business owners or as owners to be able to get some level of supports and or suspensions of certain parts of their insurance? Can you just let us know about that?
The supports for businesses as a whole are coming fast and furious. I think we've had 2 bills signed in the last 2 days. There's another one we're going to see in another day or two. So it's a combination of support for the individuals, which should let individuals keep doing what they need to do. We're seeing a lot come out of the Small Business Administration in terms of the availability of loans and additional monies for that. So I think the long and short of it, each agency is going to have its own situation, and so I would suggest, sitting down with your counsel and going through what's available, because there is so much that's out there that it may depend on your particular situation, but I'm also pretty confident there's going to be something that will at least ameliorate the difficulties that a particular agency may be having, because there's been so much that's been passed just in the last week.
Absolutely. One of those, we know that the SBA is moving forward with providing over the next quarter some very low interest loans through commercial providers on sort of payroll supports too. So we'll make that available, and we'll make some of those resources available on our resource page that's fast developing, as Colin mentioned. But definitely, would you suggest that folks on the call get into contact with their attorneys? Who else would be able to provide some point of reference in terms of some of the opportunities in this moment?
Well, I think talk to your lender. They're on top of these sort of things, and they'll have a good feel for not only what's generally available, but what they're offering in the particular circumstance. Talk to your legal counsel. I think, and then Kevin made a good point. Talk to your insurance broker about what coverages you have right now, and I would also say what coverages you could have going forward. Important to look right now. We're dealing a lot in our office with what are called force majeure clauses. In other words, something big that nobody could have anticipated happens. What does that do to your contract? Well, guess what? If this COVID-19 illness wasn't anticipated before, it is now. And anything you sign from now on, you can't say, oh, well, COVID-19, I'm going to draw on my insurance, unless it's specifically listed as something that's a problem. So you want to think about going forward. Now that people are going to say, well, we now anticipate pandemics happening. We had one in 2009. We've got one in 2020. Okay. That's something you should anticipate and factor into your agreements and your insurances, so that you're not going to look there and go, oh, shoot, now I'm not covered.
Absolutely. And on that note, Kevin, would love to know, talk to us about how you've been thinking about this. You hold a very special place as a business owner within the home care industry, and then also overseeing a group of home care agencies who look to you for leadership. How have you planned your business operations to function in a time like this? Talk to us about some of the innovations, because we know trying times can be a point of really kind of figuring things out and innovating that you've started.
Sure. So my company, Best of Care, we are in Massachusetts. We cover a significant portion of the state. So just because of our geography, we are certainly equipped to work from home at a moment's notice, just based on weather, inclement weather, and things like that in the winter, where people can't get out and into the office. So to that end, our administrative staff were easily prepared. We started taking laptops home at the beginning of March, every night, just knowing tomorrow, could be the day. So let's just start getting prepared now, bringing home essential items that you might need to start working from home. Most of us on this call utilize a 24/7 answering service. We have been leaning on them very heavily, making sure that no ringing phone hits a voicemail, making sure that it goes to an answering service, so that you've got a timestamp and a historical record of every communication that has come in. You don't want to miss that one phone call from that one aide at 12:02 a.m. who was trying to tell you that something was going wrong with one of their clients. So to that end, I've also talked to IT to make sure that our backups are functioning properly. Now that we're going to be out of this office for a while, we can't risk any type of data loss right now. It's incredibly important that we're able to access all of our systems on our servers without any interruption. So sort of micro level, that's what we have been doing internally, along the lines of what everybody else is probably doing, with making sure that you have clear communication channels to the aides. They know exactly where and when they can come to get their gloves, come to get their masks if they need them. In the event that your office building is no longer accessible, we had all of our scheduling coordinators take home several boxes of gloves. They're meeting aides out in the fields, meeting them, in parking lots, wherever it might be, to make sure that they have the supplies that they need. So really, there's no one right way to do it, so long as you have found a way to make sure everyone on your team knows that they are accountable in some way to support your aides, because we will be working through any shelter in place, any national emergency. It does not matter. We have to go to work.
That's great, and that's phenomenal. So just even to recap for some of the folks out in the audience, it sounds like you've doubled down on some of the existing resources that you have, your answering service, making sure that answering services are, you're expanding capacity, and you've also made sure that folks can work remotely, but they also have the ability, and you're utilizing your administrators and your front line, your folks in the back office to also deliver materials to caregivers as needed. Is that correct?
100% correct, yes. Everybody, it's an all hands on deck situation. And the one thing that I have absolutely stressed, whether you're a scheduler or whether you're a payroll or a billing team member, doesn't matter what, when you talk to an aide, just ask them how they're doing, how are they feeling, how's your family, how are your friends, how are your parents, how are your kids, are you holding up at home on the days that you're not working, taking care of your kids like the rest of us are. We're all human beings, and everybody just needs to feel that support right now, because the aides are doing something far more courageous than I am, sitting at home on a webinar right now. So it's important to just kind of keep that perspective as we move forward.
Amen to that. Really appreciate that. Thank you so much for stating that. And then just to even the point that Colin was making earlier, Kevin, what are some of the resources that you're hearing about that are coming down the line? Because essentially, home care agencies typically are small business owners. What are the resources that folks can tap into that you're recommending that your staff tap into as well?
Sure. So in addition to the SBA loans that Colin referenced in his remarks a few moments ago, keep your eyes on any information, any news that comes out of basically a state house, in your state. That is a reliable channel of information right now. Talk to chambers of commerce, whether it's through a large city. All of their members are businesses across various communities. They may have information about loan programs or financing initiatives that are taking place right now that you're not aware of just yet. If you are a trade association member, make sure that you are talking to the presidents and the executive leadership of your trade association right now to see what they are hearing at the state and federal levels with respect to new guidance. But more specifically, just to give you a little framework, in Massachusetts, in my role as president of the Home Care Aide Council, we represent home care agencies across the state. We're talking specifically to our referral partners at the state to say, not are you going to do this, but when are you going to pay us when an aide shows up to work and gets canceled because the client's afraid of letting someone into the home? We're going to pay those aides. We have an obligation to make sure that those aides are getting paid. We want to be reimbursed at this time. So we're pushing on our partners at the state level to make sure that they understand that A, we are essential workers, so that if you go to a shutdown, our aides need to be out and they need to be able to go to work, and we need to be able to support them. And we need to make sure that they are included in any type of funding or emergency financial initiatives that will go directly to them. So lean on your trade associations to do that work on your behalf while you're trying to manage your company.
That's very, very prudent advice, and really appreciate that. And in terms of communicating directly with staff, how would you recommend that folks do that at this time, knowing that, so for instance, here at CareAcademy, we're heavily reliant, even more so, on communication channels like Slack and like text messaging. How are you communicating with your staff, and how would you recommend, or are there any recommendations that you would make to the audience today?
Sure. So at my agency, we are working and managing a group north of 400 people in terms of aides and administrators. And so from my seat, as a CEO of the company, I am trying to be very careful with the frequency of my communication with company-wide email. I want to get to a point where the aides are hearing from me and knowing that if they're getting a message from me, that it's probably a major announcement or an update. Now is not the time to flood people with piecemeal trickles, dribs, and drabs of information as it comes out. You want to be able to hit them with some strong bullets in that email, whether you're sending it in the morning or the evening, whatever is most effective for your company is fine. And then let your supervisors, your managers, your schedulers carry other messages on your behalf in their day-to-day, hour-by-hour communications with the aides, and let them take some specific messages on a more sort of granular and micro level and communicate that to the aides, because the aides just need to be heard from. They need their phone calls returned quickly. They just need to know that the agency who's expecting them to work around the clock is also working around the clock. So with respect to communication strategy, we've really emphasized making the aides feel supported, asking them questions about how they are and how their clients are doing. And then I'm scheduling my my mass emails for basically, really big pictures or major shifts in ongoing guidance.
That's really helpful. And the last question that I have for you right now, Kevin, so just in terms of, we know that there's a lot of triaging happening right now, right? That we direct care workers on the front lines. How are you making sure that you're able to reduce face-to-face visits maybe in this time, if it's not needed, and making sure that the right caregivers are working with the right clients in this time? How are you guys thinking about triaging care and managing that? And what are some of the opportunities that folks should be thinking about on the line?
So effective Tuesday of this week, we moved all of our nursing supervisions, all of our homemaker and companion supervisions that typically occur face-to-face in our clients' homes. Those have all been transitioned indefinitely to telephonic communication. We have received the green light from the Executive Office of Elder Affairs here in Massachusetts. Again, I can't speak to every other state's infrastructure in terms of how this type of business is reimbursed, handled, or administrated. However, our association made a push that said we can help reduce exposure in the homes of people by people who are not delivering hands-on care if we can transition these nursing visits to telephone check-ins. Yeah. So immediately we've started to reduce foot traffic in and out of homes, off the road, and we're helping to keep some of those nurses safe. And now we have devoted most of their efforts. So every time we get someone who calls out sick, we've got a nurse checking in with them. We're doing a symptom screening. We're doing a wellness screening. And we're communicating also with our nurses to clients who call in to say that they're not feeling well. So the nurses have moved into more of a telephonic capacity at this point. Anything that you can do in any approved payer, any approval you can get from your payers, will say during this moment, you can bill us for a service that you're doing via telephone. Start to explore that immediately.
Absolutely. So while we're even on the subject of face-to-face and limiting contact wherever possible, Dr. Reddy, we had a question earlier this week come by way of an agency who's asking about the recommendation around protective equipment for home visits. Currently it's maybe the face masks, and they're speaking as a Canadian company as well. But what are your recommendations right now, just given that yes, there's a push to have protective equipment. We also know that there's a shortage. What are your recommendations in terms of protective equipment and availability, and just even in terms of what home care agencies should be talking to their caregivers about?
Yeah, I mean, that's such a common question. And the WHO, the World Health Organization, has pretty clear guidelines on how we should manage the masks and how we should manage our personal protective equipment during this time, because we are in a shortage of PPE, absolutely, all over the world. And we will only be needing more and more. And that's even in the acute care hospitals, and rehab is worse, and home care, I think, will be even more of a challenge. However, the guidelines right now are that if a patient has is positive or has been exposed to coronavirus, that patient should wear just a regular surgical mask if somebody else, like a caregiver, is in the room with him or her. The caregiver, as long as they're 6 feet away or more, they don't need to wear any kind of a mask. If the care worker or direct care worker is within 3 feet and providing, the regular personal care, again, all they need is a regular mask. They do not need an N95 mask unless they're working with a patient who is going through an aerosol generating procedure, such as intubation or ventilation. Now, the N95 masks are extremely hard to come by, even, like I said, in post-acute care and in hospitals, and in the ICUs. And even in those places, there have been a lot of looseness, I guess, in previously strict, single use of these masks. Now, in those institutions, we're using those masks more than once. So the surgical regular masks, which I believe most home care workers will just need a regular mask, if anything, when they're around a patient with coronavirus or who have been exposed to coronavirus. Even those are in extremely short supply. So we've started, actually, in my institution and a number of other places, having our community sew these surgical masks. So yeah, I think people who feel concerned, I think the N95 masks are going to be needed few and far between in the community, and certainly their availability will be very hard to come by in the community.
Okay, absolutely.
That's questions?
Yeah, that's perfect. Colin, did you have anything else in addition to that, too, in terms of procedures or best procedures for home care as we're thinking about that?
No, I mean, I think that's exactly, it's people have got to be smart about these things, and when in doubt, put that distance between you and another person, regardless of what you know about that person's status. I think we're going to know more about status as we do more testing, but I don't know how much science there is yet. I'd be interested in what Midori has to say about how soon you can actually pick up an infection on the test. So I don't think test results should at all be a substitute for good distancing procedures, masking, gloving, and so forth. I think you have to assume until we get a lot better at this that the other person could have an infection as you're interacting with them.
Oh, yeah, absolutely, Colin. Yeah, you're absolutely correct. And which is why we're doing this even in our daily lives, right, to stay to 6 feet away. And the use of the masks is really to be saved unless there's so few, is unless the patient you feel has had or somebody has felt that they have had an exposure or test positive. And the tests themselves, I mean, they're starting to be done more. And certainly all 50 states have had people test positive now, and you see some states have much higher numbers than others, and that probably has a lot to do with just how many tests are being done in those states. But as we get more and more tests done, yeah, the numbers are just going to go up even more before they go back down. And I mean, right now the thinking is that the virus can be spread 2 to 14 days after exposure. How fast we're going to be able to get test results back, et cetera. I mean, I think that's going to be changing, and it really depends on your state and locality. And I heard, I can't remember what state it has like 1,000 tests on backlog, even ones that were actually taken. So you're right, we can't depend on the testing.
Yeah. Thank you so much. So I'm going to ask this question. Colin, Kevin, provide insights, and then we're going to switch to a couple of the questions that are coming through right now that we may not have already answered. So I'll ask this question while we tee up some of those questions. So can you confirm that if someone is, this is a question that came by way of an agency owner, that if someone is an exposed employee who may want to self-quarantine, what would that look like in terms of sort of labor and employment law? Would this be paid time off? If their job is flexible, what would that look like in terms of someone who's electing to self-quarantine who may have been exposed quite, we're not sure. And this seems sort of like one of those situational sort of what ifs, but very common these days. What are your thoughts around that, Colin?
Well, I guess it depends. You said they've chosen to self-quarantine, but in advance of this, the employer should have a policy and say, what's our policy if someone thinks they've been exposed? What are we going to do? How are we going to treat those folks from an employment standpoint? Are we going to put them on duty that they can do things, if they can still work remotely, maybe they can't have individual client interaction, but they can do follow-up calls, then they can still work. And so you don't have to put them on any kind of leave. You don't have to discharge them in any ways. You can keep them working. And I think that's what you want to think about all this in advance. Think about the various scenarios and what's our policy going to be on how we deal with it. What you don't want to do is handle this on a case-by-case basis. Oh, well, I like Kevin, but I don't like Maduri, so I'm going to fire Maduri and I'm going to keep Kevin, even though they're in the same clinical state. So I think that's what you really want to try to avoid, because it's when you make those individualized decisions that people start to accuse you of being biased in one way or another. You want to have clear rules that make sense for the circumstance.
Thank you so much. I really appreciate that. And that's a great way to tee up some of the questions that we're getting right now. And we'll, transition to some of your last takeaways after that. Jen, are there questions that we are receiving right now that
There are a huge number of questions, actually, so we'll probably only be able to get through just a couple. And maybe we can follow up with the webinar next week.
Absolutely.
So the first one that came in is this person writing in says they had an employee get tested yesterday. She called her state Department of Health, and they told that person that they weren't the agency to report to. So the question is, if an employee gets tested, but you don't know the results yet, who do you report it to?
Exactly.
Or is there somebody to report it to?
Yeah, that's tough without knowing the individual state, and I don't profess to have an encyclopedic knowledge of what the reporting rules are in each state. My first guess would be State Department of Health and local Department of Health. Between those two, if you start making those reports, if they're the wrong one, they're going to know who the right one is.
Appreciate that. Another question, and just as a reminder to folks if we don't get to your question, we will actually take all the questions that we have and position them for our webinar next week, same time, same place. We'll send out invitations to those for folks who are on the webinar today or even not. Feel free to share that, and we will take nothing but your questions starting next week. Another question, Jen?
So I worry that we don't have an answer for this yet, but I'm going to bring it up because multiple people have been asking for more guidance on masks and where to get PPE. Basically, they're already finding that some of their suppliers are running short. So any recommendations at all? Yeah,
absolutely. And then maybe I'll add on to that. If they're directly going to suppliers, if you're, for many of the agencies on the line today, they may be part of just, larger networks too. Who should they be contacting, or where is the sort of the chain of command within the states right now and federally to deal with who gets supplies and when? And happy to have Colin and Maduri if you have insights, and definitely Kevin as well.
Yeah, well, that's the challenge. Just yesterday in a conference call with all the governors in the states, Governor Baker from Massachusetts complained about that to President Trump. He said, the federal government's outbidding us for supplies. Can you do something about that? He didn't get much of a response, unfortunately.
Mm-hmm. Yeah. So right now, it feels like very much, and every person or every organization for themselves. Do we think that Department of Health or of certain states will have maybe guidelines or recommendations? Who should we sort of be checking with? I know that there was certain states may have had a queue basically of getting supports. Do we have any insights on that?
The only thing that I will state is, as it stands today, there's been nobody able to supply an increased number of masks, and hopefully there needs to be federal funding, as Colin correctly said, to produce more and more of these masks. But as it states right now, you just have to, we all have to figure it out on our own and do our best. And nobody's, I think, going to probably fault you for doing the best you can under these circumstances, doing something reasonable under these circumstances, because this is kind of, it is an emergency. So you think if it's well thought out and you have a plan and a structure, you talk to colleagues, and again, it seems like the best you can do, then that's the best you can do. And I don't think anyone's going to fault you for not wearing specifically the type of mask. But I will also say, before, when we were talking about PPEs, gowns and gloves, et cetera, are not recommended right now for home care.
Mm-hmm. All right. So just from a standpoint of being mindful of time, we want to make sure that we get as many questions in as possible, and we'll also make sure that we have some of these questions also answered. Is there maybe one final question or that we have from the line that, yeah?
So there's a bunch of people who have asked variations of the question I'm about to formulate on behalf of several people out here, but they're basically looking for more guidance around when you find out a client has, either a client or an employee has the virus. What are your obligations, both to the client, their family, and the employee at that point? Like, should people be taking them off shift? As non-medical agencies, should they still actually be caring for a person who has the virus, basically? Yeah.
Absolutely. Colin, do you have any thoughts?
Yeah.
So some of that may also differ state by state in terms of the rules. I think the first thing, when we're dealing with clients, you want to make sure that people who've come in contact with them are informed. And the way that I like to approach that is, rather than being technical and legal about it, they say, hey, you've come up positive. Is it all right if we tell your caregivers and those who came in contact with you that you've tested positive? I think most people are going to say yes. That eliminates, document that, and then you can go about making that notice. Again, I go back to my earlier question. If you can't adequately care for that client, then you can't keep them as a client. But I mean, to me, in a real and practical sense, we don't want to be discharging these clients if we can care for them. With regard to the home care worker, again, I think we talked about some of those scenarios. If you can, certainly we don't want to make things worse. And so if there is a legitimate suspicion that someone's been exposed, then and they're going to be in a setting where they could have to break the 6 feet barrier, then you don't want them in that setting. You've got to find an alternative duty for them of some sort, and if there's no alternative duty, then they just can't work.
Absolutely. All right. So on that note, I want to just go ahead and first and foremost, I want to say in this time, thank you again so much, Colin, Maduri, Kevin, for just answering some of these very tough questions. We know that some of the answers to the questions that you answer today may change tomorrow, right? And that's why we want to make sure that we keep the supports coming. And I really appreciate you taking some of the time out today. So I want to go ahead and get into your final takeaways, just very quick, pithy takeaways. If you can provide just your initial thoughts, I'll just go down in order of how I see it. Colin, Maduri, and Kevin, what are your just quick takeaways, and then we'll also get to the supports that CareAcademy is providing for agencies. Colin?
Right. This one, it's become a favorite saying of mine, slow is smooth and smooth is fast. And you say, well, how, if you follow the logic, then slow is fast? And the answer is yes, exactly. I know in these times we're struggling to do a bazillion things at once, but you've got to, just where you start out, Helen, take a breath, get that thing in front of you done and do it right. If you do it wrong, you're going to have to come back and do it again. And that's going to be worse overall in terms of time saving. So take your time, do things right, and then you'll be operating as optimally as you can possibly do, which is what we're all trying to do.
Kevin?
My takeaway was to project confidence and calmness to your administrative staff and to your aides. Whether you know it or not, they are looking to you to basically see how they should feel about what's going on right now, especially as it relates to their job and going into the homes of people who are almost exclusively in the at-risk category. So no matter how nervous or panicked you are about your family, about yourself, about your parents, your friends, when you're having those conversations with the team, be confident and be calm.
Absolutely. Maduri?
So right now, they're projecting, CDC and others are projecting that about 40 to 50% of people in our community will test positive or be infected with this virus. And healthcare workers, especially direct care workers, including those that are non-medical, are obviously at higher risk because of the jobs that we all do. And we need to balance keeping them safe, which is the most important thing, with our role and role in the community. So a lot of questions today asked, how do we keep them safe and can we keep clients? And I think that is right now the balancing act. That's a big question, how we do that safely for everybody.
Absolutely. And the next set?
Well, I think, we've talked about it before. We've got to put the protection of staff as a primary objective here. We're all trying to reduce the level of infection from those who are infected connecting with other folks. And the staff have to know that they're going to be safe, because if they don't feel safe, if they don't feel protected and supported, then they're not going to come to work. And if they don't come to work, then we've got bigger problems. And so that's building on what Kevin was talking about. You've got to project confidence that you know what you're doing, but you're going to project to them, I'm going to look out after you. I've got your back. Come to, and in particular, come to me if you've got a tough situation. Information and information sharing is vitally important. We've got to make sure that we have the back of the staff.
Absolutely. Kevin?
Develop a communication strategy and stick with it. As of this past Monday, my admin team has a daily conference call at 3:45. So this gives us a chance, as the day is sort of ticking down towards the end, at least on the business clock side of things, for us to get together, talk about what happened during the day, talk about any unusual experiences that somebody may have had that they can share with the rest of the team, because our geographic footprint takes us across the state. So we want to hear about what's going on out in Springfield, Massachusetts, compared to what's happening on the South Shore, south of Boston in Massachusetts. And it gives everybody one little piece of routine that they can cling to. And routine is an important thing right now, so that when you're working from home, if you can bake something into that routine, you know that you've got one thing that you're looking ahead to at a certain time. I think it's helpful, and everybody seems to be, having a little bit of a laugh and a sigh of relief and exhale when we have these calls.
Absolutely. That's great. And Maduri, we'll do one last set of takeaways as well. Maduri?
So as we mentioned already, there are so many unknowns, more unknowns that are knowns really at this point, and we receive daily guidance, constantly updated news. So as the number of testing is going up, as I mentioned before, the numbers of infected are going to look like they're going up. They actually also be going up, but the combo of testing and infections will just go up before they go down. So just be prepared for that number. And all we can really do is just stay calm, follow the recommendations. I think many of you, like me, you tend to want to do perfect, follow what the exact guidelines are. And in this situation, as I mentioned before, you have to follow guidelines, but also you may not be getting specific recommendations, as we saw today about a number of things. So to kind of just do your best in the situation is important.
Yeah. Absolutely, absolutely. And the third set, and we'll send out these in a wrap-up email as well. Colin, this is perfect segueing right here. It's like we set it up.
It's like we planned this, isn't it? Yes. It's do the right thing. There are going to be situations where there's no clear rule. Things are moving too fast. And so step back, say, what's the right thing to do here? Try to figure that out, in terms of, and right is, it's going to maybe a complicated concept, and maybe, like Kevin's suggesting, okay, on our 3:45 call, this is a tough case. What do we do? Bring other people in and get their view, and let's make a group decision on what the right thing here is to do. Document why we did it. My guess is you're not going to get a lot of second guessing if you document that you tried to do the right thing, even if it turns out in hindsight it wasn't.
Absolutely. Kevin?
Talk to your fellow agency owners and your peers constantly right now. I'm having as many conversations with friends, peers, and colleagues who run organizations like mine as I am with my own team. We're taking best practices. We're copy and pasting memos from one another. All of our aides work for multiple companies. So the more that we can do to align our messaging with one another as providers and as employers, the better it is. The aides don't need to hear 31 different flavors of messaging about COVID-19 right now because they work for 3 different companies. Mm-hmm. Talk to your peers, talk to your colleagues, see what everybody's doing, try to put some best practices in place right now. The aides need consistency. They don't need confusion right now.
Absolutely. And last one, Maduri.
So look, there are going to be shortages of personal protective equipment. So I think it's really important to not overuse the ones you have as well. Healthy people don't need to wear masks unless, like I said, if the direct care worker is within 6 feet or within 3 feet specifically when they're performing personal duties, they need to wear a mask, and then the patient, if they're positive or has been exposed, need to wear a mask. But again, as Colin said, do the right thing. If you don't have the masks, you need to figure out a way to get them, or figure out a way to make them, or figure out what you're going to do in the interim, but think it out and document it.
Awesome. Well, with that being said, I want to go ahead and let you all know, so as of today, we are offering a free certification for direct care workers, our free COVID-19 training. So the class is a guide for caregivers. So we offer in our additional resources a blog, our free class, and then also weekly updates. So if you go to bit.ly/COVID-19 certification, that will lead you right to a class that you can take, your direct care workers can take, whether you are a CareAcademy direct customer or not. That is made available because we want to, in this time of need and crisis, make sure that we are providing some up-to-date information to direct care workers. And more importantly, there's a certificate of participation for direct care workers, so you don't need to be a CareAcademy client to access that. And that lets folks know that you're, that as a caregiver, you're getting some of the best information out there, and you're also keeping yourself aware of how to make the best and do the best in this time. We will also have a weekly, as I mentioned, weekly webinar as a support for you all. This is not the last. We will actually keep it going until you stop asking us questions. On those webinars, just in terms of the format, we'll have a trusted expert, maybe someone like Colin or Maduri. As we're getting your questions, feel free to, and we have this on our page as well, on our resources page. There'll be a link there. Ahead of those support meetings, go ahead and type in your questions and your comments. And the idea here, to Kevin's point, I think you beautifully articulated this. We're not, in this moment, it's so unprecedented that there are no experts, right? We're all doing the best that we can, and we think that you as home care agencies are also experts in this too. So we'd also love to get your comments and your advice for other home care agencies as well as direct care workers as we're going through this together. So to access our class, the free certification link is there, and we'll also send it as part of this webinar as well. And with that said, let us know if you have any questions. If you are a customer, we're also waiving access to that class. So if you're a customer, it's as many seats as you need in order to make sure that your direct care workers are taking that class. And we're waiving our fees also for additional users of that class through April 24th. And then we'll take it from there because we're all doing the best that we can right now. If you have any questions around that and you're a CareAcademy customer, feel free to give us a call as well to provide your direct care workers with that training. So with that said, we're with you in this time. Thank you so much, everyone on the panel. Thank you, Maduri, Kevin, Colin, thank you so much. And thank you all of you all. If you have any questions, let us know, and we're here to help. Thank you, everyone.
Thank you.
Thank you.